News Talk is online. News Talk is a production of peltalk.com, the largest multimedia interactive program on the internet with more than 4 million unique users. I'm your host, Gary Baumgarten. And quite often we talk about during this show, and a lot of people on Pal talk about amongst themselves in the user-generated rooms, uh, the threat of terrorism. And some people uh, are still debilitated today over what happened on September the 11th, to where they're not living their lives the way they did prior to September the 11th, 2001, especially as we get these different alerts and warnings and thwarted attacks and all kinds of nonsense that's going on in the world. I want to share with you very personally my own situation here in New York City. As many of you know, I was live on the air on CNN radio describing as the towers came down, the Twin Towers. And I had difficulty maintaining my composure, but I did my job. As time went on after that horribly tragic day, for most of us there has been a healing process. But, the psychologists say, the mental health care workers say that there are triggering moments for all of us, no matter how close or how far away perhaps we were from the events here in Shanksville, Pennsylvania, in Washington, D.C., and surely other terrorist events that have occurred around the world, in Spain, in France, in the United Kingdom, throughout the Middle East, in Bali. Um, this year during our memorial coverage on September the 11th, I thought I was over it. And then they started reading the names, and I got choked up right here on the air. But the thing is, to be healthy about this, to have a healthy approach, I truly believe that it's very important that we do not allow it to debilitate us. I know people who are very close to me who live in New Jersey who have not once returned to New York City since September the 11th, 2001. And I would argue, as a non-mental health professional, that that's probably what these terrorists want, is for people to be fearful to go about their daily lives. And the one thing we do not want is for them to control us. I don't know if that's a healthy approach to it or not, but our next guest, our first guest today, Dr. Martha Stout, can tell us. She is a best-selling author. Her latest book is called The Paranoia Switch. She, in this book, examines how our brain copes with the threat of terrorism that looms over us, and she tries to help us readjust to this new world that we're living in. So, Dr. Stout, I want to welcome you to News Talk Online on peltalk.com.
Thanks. It's good to be here.
It's good to have you. And by the way, I have read one of your previous books about sociopaths. And it really gave me a clear understanding of somebody that I was dealing with, because it allowed me to let go of that person's transgressions, because I now understand that the person is wired differently than people who are normal, and the individual probably didn't know what she was doing. I mean, she didn't know any better. And to have you on the show, I kind of feel like I know you after reading you. I haven't had opportunity to read The Paranoia Switch, unfortunately, but I understand in brief what I think you're trying to say in the book. But we're going to give you opportunity in this next hour or 45 minutes to try to expand on that. Is my lead into you accurate, that we've got to not allow the threat of terrorism and the repeated talk on the television and on the radio and in the newspapers and even here on the internet, this show, to debilitate us?
Well, I think that's right. That, of course, is a more philosophical question than a psychological one, what we want to do about terrorism and what we want the effect to be or not to be. Just like I'm glad that you read The Sociopath Next Door, and I'm glad that helped you. And I can describe sociopathy and the phenomenology of it and so forth. But then I think it's up to the individual person to decide, how do I want to think about that and deal with that in my own life. The same is true of terrorism and all of the fear politics that had surrounded that in this country, the United States, for 6 years. As a psychologist, I can tell you that traumatic memory is stored in the brain, actually at the level of the gray matter. It's stored differently from the way we store regular memories. If I say, Aunt Susie took me to the zoo, if that's a memory that I have, I can think about that. I can state it in words to myself and to other people. I can talk about it. I can add to the memory. I can add other memories about my aunt and so forth. Traumatic memory is not stored that way. It never gets sent, so to speak, by the brain to the higher levels of our brain that might put it into words and concepts. It gets stored as tiny little triggers in our brains that consist of little images and flashes of sensation and pictures that aren't integrated, that we probably won't even think of as memory. And oftentimes we don't even know that they're there. And that is how a traumatic memory can keep affecting us even years later, because it's frozen there. It's frozen in time, and we can't put words on it, so we can't talk to other people, and it just stays there stuck. Still, I can say that after 6 years, one would have expected a large population like the United States to have calmed down more than we have, to be less affected than we have. So that brings the question of why have we not? And I think that answer may be pretty obvious psychologically too. For 6 years, every time we've turned on the television or read our newspapers, someone else is telling us to be very, very frightened. It's not just the reports of actual terrorism. Much more frequently than that, we see people who are talking about terrorism that might happen or might have happened, and all the gruesome scenarios that keep us scared to death. I think that you're right. I think we don't want to react that way because I think that means the terrorists win. That's the point of terrorism, to enter our minds, the minds of the living, and to stay there as long as they possibly can. That's different from grief. That's different, I think, from choking up when you hear the list of names. I think one of the things our fear has done is it's prevented us from grieving the way we should have, the way we could have if we hadn't been so scared. Dealing with that kind of traumatic memory and having a healthy grief response, those two things don't go together.
Well, in fact, there is a way to approach these situations that I would believe to be less debilitating. For example, I give high marks personally to Mayor Michael Bloomberg here in New York City, because when there is some kind of a terror threat, he very calmly says, look, we are going to do what we can do to protect you, but we want you to go about your daily business, because there's no need to fear riding the subway, riding the buses, walking down Broadway, walking across 42nd Street. You've got to be prudent. You've got to be aware of what's around you. Yes, if you see something, say something, but don't be afraid to go out and enjoy New York City. Now, part of that is because he doesn't want his city to die because people are afraid to come out. That's true. But part of it is, I believe, is a sincere belief on his part. And I covered the guy when I was at CNN here in New York City, so I think I have a little bit of a sense of who he is. That you don't want to be debilitated. I keep using that word. Perhaps there's another one you could come up with, Dr. Martha Stout, that